What if you could amplify the power of every single doctor in a healthcare system that's already stretched to its breaking point? For millions of people, this isn't some hypothetical question, and it's right at the heart of what we're exploring today. Okay, so the problem really starts with a number. And honestly, it's a number that's kind of hard to wrap your head around. In Nigeria, there is just one single doctor for every 3,500 people. Just let that sink in for a second. To put that into perspective, the World Health Organization recommends a ratio of one doctor to 600 people. As you can see right here, Nigeria's reality is nearly 6 times worse than that recommendation. And this isn't just a gap on a chart. For patients on the ground, this is a massive, massive chasm. So, how do we get from this crisis to a potential solution? Well, here's our roadmap. We'll start by digging into the human cost of this shortage. Then we'll explore an innovative new approach, see how it completely transforms the patient experience, and break down the really clever model that makes it all sustainable. And finally, we'll ask that big question: can technology really be the answer? Right, so behind that staggering ratio of 3,500 to 1 is a very real, very human cost. Let's talk about what this shortage actually feels like for a patient. So this shortage, it translates into an average wait time of 8 hours just to see a doctor. 8 hours. And if you actually make it through that line, you might only get 5 minutes of their time. And here's the real kicker. For a staggering 60% of people in underserved areas, the reality is they may never see a doctor at all. But it's often right in the middle of a crisis like this that the most powerful innovations are born. And this quote, it really says it all. A crisis can create an opportunity. In Nigeria, that opportunity is being seized by a platform called Medcare. So what is Medcare exactly? This part is absolutely crucial. It is not about replacing doctors. It's a platform designed to be a force multiplier, to amplify the skills of every healthcare worker, making them more efficient and extending their reach way beyond what was possible before. Okay, so how does this actually change things for the patient on the ground? Let's walk through the new experience step by step. The process is designed to be incredibly simple and accessible. It all starts with an AI-powered triage to assess your symptoms right from your phone. Based on that, you're connected to a healthcare professional for a virtual consultation, and if you need one, a prescription is sent directly to you. That's it. And the result of this, it's completely transformative. That traditional 8-hour wait is just crushed down to less than 45 minutes, from that first symptom check all the way to getting a prescription. I mean, it is a true night and day difference in how people get access to care. But this brings up a really critical question, right? How can a high-tech system like this possibly be financially sustainable, especially in communities with low resources? Let's take a look at the model. The answer is a really clever hybrid access model. And the core idea is to keep the service affordable, or even completely free, for individual patients. The platform generates revenue from institutions like hospitals and NGOs, who pay for premium access and other features. So here's how that works in the real world. Medicare diversifies its income so the financial burden doesn't just fall on the patient. So while individuals can get basic access for free, the platform is kept running by subscriptions from healthcare providers, insurance companies, and NGOs. So the crucial takeaway here is this: patients can always access the core AI service for free. The platform sustains itself through business-to-business and business-to-business-to-consumer partnerships. All that really means is that other organizations like a company or an NGO pay for those premium features and sponsor access for their own members. This model creates this amazing virtuous cycle. It's affordable because basic access is free. It's scalable because it can plug into both private clinics and public health systems. It's inclusive because it was designed from the ground up for low resource settings. And it's financially sustainable because of those multiple revenue streams. It just works. All of this brings us right back to our big picture question. What is the true potential of technology when it comes to solving global health crises like this one? And Medicare's vision goes even beyond individual patient care. The platform is also using its data to map out entire healthcare deserts. These are areas with little to no medical access. This allows public health organizations to proactively channel resources to the communities that need them the absolute most. So when you see the immense scale of the problem, and then you see the tangible, real-world potential of a solution like Medicare, it leaves you with one final powerful question. Given what's at stake, can we really afford not to try?